Join me as I talk with people who express their creativity in ways that can inspire the rest of us to recognize our own creativity. And if you enjoy these conversations, please like, subscribe, and share them. Hello and welcome to Creativity Conversations. This is episode 58 and I'm with the handsome and talented Dr. Richard Kim. Hello.
Hi, how are you?
I'm well. Good to have you here.
Thank you.
As we usually do, I'm going to start with a bit of a bio for Dr. Kim, and then we are just going to see what happens. So Dr. Richard Kim is a board-certified physician whose practices focus on the use of complementary non-surgical disciplines and therapies, in particular platelet-rich plasma, PRP, and stem cell therapy. He has a sharp, inquisitive approach to medicine and uses a rare combination of clinical training and research experience to diagnose musculoskeletal problems, almost messed it up, and develop a unique treatment plan for his patients. And I'm taking this from his website, but I think it's true too. Dr. Kim has a refreshingly laid-back vibe, which he attributes to his West Coast upbringing, in combination with his high degree of compassion. He is committed to helping his patients return to their active lifestyles through the highest standard of care and the newest technology to enable their bodies to heal themselves. And he demonstrates the same commitment on the sidelines, so to speak, in his role providing care for the elite athletes of USA Rugby. 10 years now, right?
Absolutely, yeah, just coming up on it.
Wow. So Dr. Kim is board certified in internal medicine and pediatrics with a certificate of added qualification in sports medicine and is team physician USA Rugby. He completed his medical training through Albany Medical College, completed a sports medicine fellowship, and received his undergraduate degree from University of Washington.
Thank you.
And that's
Thank
just
you
the beginning.
Yeah, right. Where do we go from there?
Anywhere you'd like.
Yeah.
So, you know what I would love to do is to start off is just to ask you what your definition is of creativity.
Man, that's a really good question. I think for me, the definition of creativity is trying to make something from nothing or trying to create something from what others might see as nothing. And having a either different form or function that suits you or suits the need. I think a lot of times in medicine we don't think about it as a creative field, but I think it absolutely is. We often say that medicine is an art and not a science. So to me, I think very much what I do, what medicine is very much art and takes a great deal of creativity.
Well, you're a lot like a detective, aren't you? Because you're finding pieces of a puzzle and
Yeah.
seeing how they relate to each other and what the big picture looks like, as well as the one that you're honing in on.
Yeah, I mean, even as I'm looking at these pictures behind you, you've got this juxtaposition between purple and blue, and then it is that you have to take some certain paintbrushes, or you've got to take certain mediums. In our world, it's what patients tell you. It is what we can gather from physical exam, or it's what we can gather from X-rays or MRIs or ultrasounds or whatever, and then cobble together a picture. And sometimes that picture turns out exactly like it was supposed to, and sometimes you're pretty close, but is pretty close is that good enough? So yeah, absolutely. We've got different medium, but very much the same idea, trying to pull these pieces together to tell that story.
So in addition to all of the diagnostic methods that you use, how many times do you surprise yourself by what's revealed in a conversation that you're having with a patient? Because one of the things that I think is so great about how you interact with clients and patients is that you look at them You talk to them. You're not stuck with a laptop right in front of your nose. So I'm curious, how much comes through in that conversation that you have with the patient?
I think after, having gone through a lot of schooling and a lot of training, I would probably say 80 to 85% of the time, just my conversation with people is what's most revealing. It's most revealing about what they, not just like from the medical perspective of like, what is the diagnosis and where can I get the treatment, or what should be the treatment, but it's, where 85% of what is this person really dealing with? What does this person really want out of all of this? Are they, yeah, they're telling me about maybe back pain, but what they really want is to go run around with their grandkids, or take that trip to Seattle that they haven't been able to because they're not sure that they can sustain a 6-hour plane ride. And I think that that's really where so much of it comes into play. Dropping the laptop, dropping the pen and paper sometimes is a necessity to really sort of figure out, you know, what am I looking at? Who am I really talking to? Um,
Yeah.
so yeah, I think it's part of it. It's part of the art. You've got to observe, right, in order to create or recreate or put something down.
85% is a lot.
Yeah, surprisingly. I mean, I think earlier on in the career, I put so much stock in my physical exam and into the imaging. And I'm not saying that it's not important now, but yeah, absolutely. I think now 85% of the time, I think I've gathered most of what I needed to just from the conversation.
Hmm.
It's
And
different.
it is different. It's a different way of approaching that puzzle of what's wrong and how can it be fixed. What's really behind the presentation that somebody is giving you.
Yeah, yeah, and just as we were mentioning before, people's lives are more than just about the pain or what the pain has sort of turned them into. Like everybody's got these hopes and dreams and an idea of what their retirement was supposed to look like, or the idea of what they want to do on a fall Sunday. So it's trying to figure that out.
What's the hardest element in making a diagnosis?
um I think the hardest thing is learning a couple of the fundamentals, right, in medicine. The hardest thing about diagnosis is learning that nature and what happens in the world um, happens, with the idea of this bell curve, that things happen, from the center, and then like one standard deviation out, and that's going to capture about 70% of your of things. Two standard deviations out is 95%, and then going further out from there is sort of the zebras, the hard things. It's learning that, and we in medicine we often say it's common things being common things uncommonly, uncommon things commonly, and then lastly uncommon things uncommonly. So sort of like knowing that that's really what's going to come through your door, is and sort of learning that practice is probably the hardest part. Once you can sort of get through that and not chase that rare and mystical, Amazonian disease that that you read about once, tempting, very tempting to chase and to follow, but realize, that that we are, in a lot of ways very similar, and how things either come apart or come together, in nature. It's it follows certain rules.
And what I'm wondering are how much do those rules actually play a major part in your diagnosis? I'm thinking about how if you go in generally, if you go in to see a physician for some problem, they start with the absolute worst that it could be, and then they work their way back. Is that accurate, or is that just me?
Yeah, I mean, there is a certain truth to that. while, you know, we talk about these things, common things being uncommon, you know, when there are red flags, or when there are, you know, certain parts of the picture that don't look like they belong, and they belong to something a little bit more sinister, you do have to be more, you know, you know, you still have to think about that person, and, you know, not want the worst possible outcome. Because I mean, in this uh you know, medical atmosphere now, like, we're it's got to be a relationship, and if you care about this person, you want what's best for them, and to have, you know, and they're coming to you in this like real state of vulnerability, and, you know, in that relationship, you want them to, you want to be able to lead them, to guide them, and even though it's this sort of conversation back and forth, sort of take them away from, and, you know, make sure that the ugliest and the most sinister things aren't there. With that being said, yes, you know, there again, some people just love that, you know, brown recluse spider bites from I don't know, deep in sub-Saharan Africa, like they jump to that. But yeah, sometimes some people just fall into that. Some clinicians fall into that trap. Um, but, you know, part of our job is to um, look out for people, and just make sure that, you know, they're in the right hands, or they're in the right place.
So it's not such a bad thing after all.
Exactly. That stubbed toe, yeah, it's probably, that's all it is.
Well, you know what strikes me in terms of what you're saying is about relationship with patients, and that just seems unusual to me in terms of.
Really?
I mean, I
Why?
love it. I love it, but what I'm saying is, so many physicians are just by the book. You know, they check off the list of things they're supposed to look for. There's not that much of a sense of connection or relationship with their patients. I've certainly had that on more than one occasion, and I think that's one thing that's unusual about you, is that you make that effort
Yeah.
to have a relationship. And I think in doing, I'm projecting this, maybe I'm wrong, but I think in doing that, you invite more information into the equation.
Sure. Sure. I mean, I think if the clinician, you know, shows some vulnerability, I think, you know, you sort of can tease out a little bit more. I mean, I guess the question back, sort of, I'm sorry to question the interviewer, but I mean, sometimes, you know, have you've probably seen examples of mass-produced art, right? And the quality of it, it's, you know,
Yeah.
it follows, you know, a pretty narrow profile.
Like
Yes,
paintings on velvet.
sure, sure. You know, and I think, you know, that's kind of what's happening to medicine now, is that, you know, it's kind of there, it's in a way mass produced, and, you know, so it's losing that vulnerability, it's losing that sense of its art. And, you know, and I get it, you know, cost of patients and costs of people rise, right? But the dollars that are involved in taking care of people are dwindling. So, you know, I think we're forced to say, all right, let's not create interesting art, but let's just create a piece of art and send that out the door. And I think, unfortunately, that's the pitfall, but it's also creating, I think, a lot of, you know, victims in the process.
Yeah,
You
yeah,
know?
I think that's true. You know, I think one of the things, and I suppose this falls within the realm of creativity, is that even if somebody doesn't know what's wrong with them, nor does the physician at the time, still that human connection is some kind of reassurance. Okay, so nobody knows what's going on, but at least they're trying.
Right. Yeah. It's like, you know, in some of that like mass production mentality, you know, I think too many times it's, you know, sometimes my analogy will be either a microwave, but I think probably more accurate, a drive through. When I order, by the time I get to the pickup window, you know, coffee should be 122 degrees and there should be a secure lid on it. And, you know, but it's unfortunately doesn't work that way. It's not, you can't turn it into that. But you know, that's it's a big problem, and I don't know that I know the solution, but I think if we sort of maybe some of us try to revert back, and try to have the pendulum swing the other way, you know, maybe somewhere along the line somebody will have the idea or the solution to sort of value, you know, the relationship process, and because, you know, sometimes you're right, it takes time to just sit down with somebody and say, well, what is it that you're really saying? And did anybody ever think of this? Did anybody ever think of that? And if you don't, and if you're not, you're only as good as, you know, the number of diagnoses that you can think of, right? If you can only think of 2 diagnoses, well, then guess what? Every single one of your patients will have 1 or 2 diagnoses. But if you can think of 10, you know, you're gonna, you know, you're gonna be a bit more valuable. You're gonna be a bit more, you know, part of the process.
So since you spoke about the drive-through, what do you think about telemedicine?
Yeah, I mean, it has a place. You know, I think for a lot of people, it has a place. You lose something in it. You know, I think not being able to examine somebody, you know, and not being able to you know, have only, I don't know, 64 hues of white. You know, I think there's some limitations to it. But you know, that's kind of what the demand is now. It probably works great for things like psychiatry and some other fields where, you know, the verbal dialogue is almost all of it.
Mm.
But you know, in a field like mine where I've got to put my hands on the patient and examine and see how the knee bends or how little it bends or whether or not there's fluid building around the knee, it's definitely limited. This is good for, you know, probably explaining, you know, a little bit about the therapy that I do, or initially getting the conversation. But in order to get that full, you know, beyond that 85%, getting that full picture, that last 15%, you know, I certainly, for me, I prefer to have the person in the room.
Mm.
Yeah.
I do too.
Yeah.
Can we talk a little bit about the direction that you've gone in with your practice and what made you focus not just on sports medicine, but on PRP and stem cell?
Yeah, I mean, I think kind of like everything that we were talking about before, that, you know, how medicine now is, it's pretty definitive, you know, grooves in the concrete. And I won't even say grooves in the sand, but grooves in the concrete. And it's pretty hard to veer from that. The initial first few years after having done most of my training, I felt pretty limited in that, you know, despite how much I could learn and make a great diagnosis on patients, the therapies were limited. It was either pretty much steroids, physical therapy, and then, you know, because of lack of anything else, really having to send people on to surgery. When I finally learned that there was another alternative, it is definitely an alternative, but you know, a good alternative existed. It helped me really, you know, offer to patients, you know, something viable, something that wasn't going to involve, you know, some of the
Knives.
knives. Yeah, pretty much. Yeah, you pretty much said it. You know, and with knives come bigger complications, and so it was nice to be able to do that for people. And then, you know, for me, it was, I liked the idea of having my own practice, and so that I can put down the computer and look at somebody in the face and talk to them eye to eye. That was pretty, you know, valuable to me. So that this development of and sort of push in this direction with the practice definitely helped keep that you know, part of the practice alive.
So I'd love you to talk a little bit more about how those two therapies work. But what I'm thinking as you're talking is that much like the nature of creativity in general, these two avenues have a lot of possibility in them that are not necessarily ascribed to mainstream medical therapies.
Yeah. So I'll get microscopic, and then I'll get macroscopic. So microscopically, so platelet-rich plasma and stem cell-based therapies are what we call autologous therapies. So platelet-rich plasma means I extract the platelets out of your blood, and then I can apply it to certain conditions, arthritis, tendon pathologies. I can apply it to certain nerve disorders, ligament disorders. Stem cells, similar, except not only are we using platelets in that, we're using stem cells, and stem cells exist all throughout the body. They live in your bone marrow, your fat, and so it's a matter of extraction, purification, and then its application. It's early enough that we don't know its full capacity, or even its full, not just capacity, but full. I want to say something along the lines how we purify and sort of extract it fully. So there's some of the processing even that we don't know, and that we're learning to do better. But what it has done is people have come to us now with issues that previously weren't, amenable to any other sort of conventional therapy, and we've been able to now offer, well, here's something we can try. Fundamentally, some of this works. Kind of like, I've got this. I keep using paintbrush, but here's this paintbrush. And I think your canvas looks like it might hold paint, but I'm not sure. But at the very least, it's not going to make it uglier. It's not going to make it, less attractive, or ruin the canvas. So it's really given us a stepping point for doing things. Just a case in point, we had a gentleman who just came in today, and he's had back surgery, pain, and issues running down his leg. And I said, quite frankly, I don't know if these therapies are definitively going to resolve all of your issues, but you really don't have a whole lot of other options. And this option very well might carry some potential. And, I think for them, they were ready to do something and try something. And I think that's the problem, is that the landscape, the number of paintbrushes that we have is so limited. So it's nice to be able to reach into the toolbox and say, oh, well, here's this thing that just might do the trick for a lot of people.
The more you describe this, the more it sounds like not boilerplate, but all of the components of being creative in terms of exploring and experimenting and just trying stuff to see whether it works or not. It may not necessarily be as, I don't know if this is true or not, efficient as maybe other more traditional methods, but it certainly seems like you can, as you're exploring those potential uses for those therapies, that you're able to uncover other possibilities for how they can be applied.
Yeah, I mean, it's like unearthing the soil a bit, or lifting a corner of the rug, and there's a whole heck of a lot of things under there, and I think by being willing to try, and being, again, vulnerable, and being honest with people, and I think a lot of people are desperate's not the right word, but a lot of people are anxious to try something different, something new, and even if the results aren't guaranteed, because the need is out there. The future of a lot of what we do has a whole lot of potential. But I think that just goes along with science and technology, right? That what we're doing now is far more molecular, far more microscopic, far more cellular in our therapies than we've ever done before. I think it'll just continue in that direction, and I think people need it. Quite frankly, people need it.
Yeah, well, there's such a disillusionment with the medical community and the lack of, the lack of humanity and the fact that there's no guarantees no matter what you use, what you try. Nobody knows what is actually going to happen, which is also part of the creative process. You never know. You can make an educated guess based on previous experience, but it seems like there is more of a willingness to try things, even if there's no guarantee with it.
Yeah. I mean, I guess the question back to you too, I mean, when you're creating art, how much of it is just you wanting to put two colors together, and then how much of it is you sort of doing some self-exploration and saying, well, what is it that I want this to be, or what is it that what am I trying to achieve here, and like a little bit of soul searching, in order to find where to find your direction for some of that. And for me, if I did that inward search, and I did some of that inward find, I'm always looking for the underdog. I'm always looking for that person who, feeling like they're a little bit despondent. I mean, I guess that's how we get drawn to medicine for a lot of us physicians. But finding where people are in need, and then being able to be that person, or be able to be that moment in time for people. And I think that helps me at least for me, lay out the plans for how to go about the practice, and how to go about therapies and future therapies.
So how does that intention to be there for that person, how does that affect your on a practical level, how does that affect your practice in terms of building it and expanding it in the direction that you go in?
Yeah, I mean, it's terrible. It's terrible. Yeah, I
Okay,
mean,
explain that.
like, I want to be everything. I want to do everything. I want to see every piece of paper, and I want to see every patient, and touch the corner of every room. But I have to realize that I can't. It's just not feasible. So it's been a lot of honest moments, a lot of real moments, talking about limitations, and what can I or can't I let go of. We just came up today with me with a stamp from the local office supply, so I didn't have to sign certain things, because I just sort of refused to not see that piece of paper and not be the person to sign off on that one thing. Yeah, I mean, I think that's something that I struggle with, but I think if I keep my eye on the grand prize, which is, I hope to create something meaningful, what I mean by that is I hope to be able to help more than just one patient at a time.
Yeah.
And I think if I keep that in focus, I have to learn to let certain things go. But you're right, it's terrible. It's terrible.
Since you can't clone yourself yet.
Not yet. Give me a few years. No.
You just better hope that technology is going to keep evolving.
Yeah, right. Yeah.
Now do you have a total of 3 offices now?
So a total of three offices. So our major office is here in Saratoga Springs or in Gansevoort. We've got one in Skaneateles, which is just past Syracuse. It's one of the Finger Lakes. And then the third one down in Suffern, down by New York City. Plans to open one in Plattsburgh and sometime in the future if the pandemic ever lets up and the borders can stay open a little bit. So yeah, I know I'm my own worst enemy.
But there's something that's a challenge for you in that, isn't it?
Yeah, I mean, in I guess could I create a mural? How big of a mural can I create it? Can I get the entire side of a building? Can I get the entire, city block? And to me, I look at that as I relish that challenge. And speaking of creativity, trying to find that person and trying to find that office space, and will it work? Will it not work? And knowing that there's a certain number of requirements that I want and I need in order to go into these places. And it takes you out of your comfort zone, really, but I think if you want to create things, sometimes you kind of have to be willing to do that. I'll ask the artist, right? I think.
Yes, I think that's true, whether it's finding a new office, finding office staff, or whether you're creating anything, because my experience is that creativity invites discomfort. But that's the whole opportunity to stretch, right? And grow and create something that's beyond what you normally would do.
Yeah, I mean, I think other people have said it as well, but being comfortable with being uncomfortable.
Right.
Yeah.
So, what have you discovered about yourself in this process of opening other offices and finding new ways to treat people? What have you noticed about yourself, besides that you often like to do things the hard way?
Yeah. So yeah, that's definitely one of the things that I learned. I learned that one of the major things that I learned was perseverance. That I have this sense of perseverance that is probably stronger than I know what's good for me. I sort of go beyond the point of wow, this is really painful, and then rather than sort of closing shop and turning around, or I somehow need to take a step, a breather, and then I'm just like right back at it, like it was going to be, and like it was meant to be this whole time. I think that's one that probably the single biggest thing that I've discovered about myself is that sense of perseverance. And I think the second thing is, as we've been talking about this whole time, is that I absolutely thrive on the creativity, on having that element of building something, of making something, that if it wasn't for that, if it was, I mean, not to discredit anybody who loves a 9-to-5 job, but but for me, just to me, 9-to-5 job scenarios feels confining for me, and then if I didn't get to step out and open up Google Maps and put down a pin and say, I wonder what it's like there to open an office, and being able to explore that, I think those two things for me, I've definitely learned over the last couple of years.
Is that how you decided on where the locations for your other offices?
I pretty much kind of did. I said, how far could I drive to and come back in one day? And so that's what Skaneateles is, and that's what Suffern is, and that's what Plattsburgh is. Full disclosure, the next time I do this, it'll probably be in another state, and so I'll have to hire at that point. Yeah.
Well, Vermont's not that far from us, so
This is true. This is true. Massachusetts, come
that's
on.
right. That's right. So what do you think, besides your never-ending love of trying to figure out how things will happen, what do you think makes you good at what you do?
Gosh, I've thought about that a little bit, because I kind of have to wonder in some of the hard moments and some of the dark moments, like, what is wrong with me? Why do I do this to myself? Like, and I can remember even back being a kid, and I was always the kid who sort of took all the toys apart. I wanted to see how things worked. My favorite was anything with a wire or a motor or a light bulb in it that I can like, put back together. And I'd have these like Frankenstein toys, you know, in my bedroom. And to me, I think that's sort of the thing. I think the willingness to take things all the way apart and then examine it from all sides, and then say, well, how can I put this back together? But how can I put this back together better? Or how can I put this back together, for what
so that it works.
Right. And being willing to do that, definitely with, I obviously I'm not experimenting on people, but with humans and people, there's some hard limitations, and but some of that comes from just simple conversation and being able to understand somebody. So I think that's the other thing too, is, early on in our interview here, talking to people, that's where I'm sort of like unpackaging things and then sort of like laying them all out and saying, well, how can we put this all back together so it works for you? I might not get back the original toy, and this might not be the original packaging, but what can we cobble together here that's going to make it work? And every patient and every person is different, and so that challenge is different every single time. And yeah, that's the drug in it.
Is that each one is unique?
Each one is unique and presents a different challenge, and requires maybe similar skill sets, but applied not always the same way.
Yeah.
Yeah. I think I just discovered something about myself there.
Should we edit this out? And what do you think in terms of your own creative process, not only with your expanding your practice into places unknown, but using the therapies that you do use? What do you think are the things that are the biggest obstacles for you?
I think time is definitely one of them. Being patient and waiting for time to evolve and letting biology happen sometimes.
Right.
I think that's one of the hardest things, because I grew up in a microwave drive-through generation, and so I felt trapped to the same thing. I just did this. Where's my result?
Where's the result?
Yeah. I think that's definitely one of the challenges. But invariably, I think giving things that extra moment, that extra little time, giving it that little chance to observe. I've learned a lot in that. That hasn't necessarily always solved all the things, but it's definitely, and probably more recently than ever, given me like that one extra facet of perspective. It doesn't have to be long sometimes, but yeah, definitely.
If there was one thing you could do all day within your practice, what would it be?
um inject.
You'll have to explain that.
One of the parts of the therapy that we do is that we take, for people who are listening to this, I'm sorry, but we take 7-inch needles, and we're getting into very precise spots in people's spines. And there's something about similar to what we're talking about before. Every spine is different, every person is different. Some people have surgery, so they have hardware. There's a unique sort of challenge to it, and being able to ferret that needle to exactly where we need it to go. And I know that, and it's not just in placing the needle, but it's in now having done what we've done, is is in the knowledge that 4 weeks from now or 8 weeks from now, that is the inception point for, changing people's lives. And there's just something really, really gratifying of being able to be at that moment. So if I had to say, is there a thing that I love and that I could do all the time, it would be that. Yeah. Yeah.
Well, you're a master at it. So
Thank you. Spent a lot of time, I terrify my kids. I say, you want to be a doctor? You only have to go to school 26 years. So, put a lot of time into it, but thank you. It's something I enjoy.
yeah, well, it shows. It shows in the quality of the work that you do.
Thank you. Thank you.
What what do you think people should know about the world of medicine and and your place in it? There are kind of two different questions there, but it seems like so much of the medical world is shrouded in mystery, whether that's deliberate or not.
Yeah. Yeah, I mean, there's definitely a veil, right? And some of it is about protecting that veil, and some of that is trying to break through that veil.
Hmm.
The one thing that I would say to people is that, that medicine is not perfect. Is that it's fallible. It is operated and delivered by humans, which means that even under the best of circumstances and under the best of training and guidelines and research and evidence that you can do, that it's still fallible, that it has, moments that the bottom drops out and you don't realize or you don't expect it to. But at the same time, as imperfect as it is the best we have. And sometimes, it things in life, I think it reflects life. That's just
Mm.
it may not be the perfect thing, but it's the best we
It's
have.
what we got.
It's what we got.
Yeah.
And sometimes to you know be part of that process and trust that process and be willing to see it through. I think a lot of people now are probably disheartened or disillusioned because, I think not, and I'll be perfectly honest, I don't think all of medicine in all corners of even our country or the globe are delivered perfectly. And to in the end to find the thing that also makes sense to you, that that works for you. I think that's important. And if you feel like you're not getting treated the right way, or if you feel like this doesn't seem right to you, then be part of the process. Be willing to explore, be willing to look, be willing to search, and be willing to find that thing that makes sense to you.
And what about robotics? How do you see that integrating into medicine? Are we still coming down to the same bottom line, which is robotics are being operated by human beings at the baseline of things?
Yeah, I mean, I think at the crux of it, somebody's got to operate that robot. I mean, even within, so robotics are great if you're expecting the same Toyota off the line, or the same Ford off of the line every time. But every single person who walks into your office or, walks into a physician's office is very, very unique, right? Even within that one standard deviation, there's tons of unique variables. Let's just take, for example, the allergies somebody has. Let's take, for example, the level of anxiety they have around the medical situation. These are the sort of things that you can't program a robot for. So yeah, I think there are parts of medicine that absolutely robots can, do a fantastic job of, but it's art. It's art.
Mm.
Mm.
Wow. So what else? What else should people know, about you and what you offer, or just in general, what are your thoughts about medicine and the practice of medicine?
Um, yeah, I mean, apart from a lot of that we've talked about now, I think, we what I really hope for, and what I anticipate in the future, is that we get back to sort of a classic style of medicine, where it is a patient and a physician in the room, regardless of computer, robot, whatever else might be in the room, that we sort of hold that as the most near and dear. And I think we've gotten away from that a lot over years, and probably because the population is ballooning, care costs are rising, number of care providers is dropping, and so the pressure to produce is there, but it shouldn't be based on production. It should be based on value of the relationship, not value of the results, if that makes sense.
It makes a lot of sense to me. I mean, if we're couching this conversation in terms of creativity, it's all about relationship.
Yeah, your relationship to the canvas, your relationship to the medium. Are you spending the time to find the exact paint color that you want? Is that the right blend of orange that you want? I don't know if you and I ever talked about this, but I spent a lot of time drawing and in art growing up. And I just remember doing a ton of charcoal and just spending oodles and oodles of time and trying to shade. Is this the right shade? No? Go back and go over it again, and being willing to go back and go over it again until it fit what you wanted, and until that last bit of, well, we use hairspray to
final fixative,
right, the fixative, and until that went on, that we just had the chance and the opportunity to go back and fix it and repair it, or to darken or lighten. So yeah, very much that way.
So what do you think that a patient's response would be without the right prep to have a physician who says, I don't know, I'm just going to try this and see what happens? I mean, that's probably what they do, right?
Yeah, I mean, I think hopefully the physician will say more than beyond just, I don't know, just try this. Hopefully they've developed a little more bedside manner that might, encapsulate that a little bit better. But, people should be willing to take a look and examine things, and just be able to, hold it in their hands and say, all right, well, if I, and what if, and if I don't, and sort of be able to project down the line a little bit in 6 months, in 12 months. Is this something irreversible? If you do this, do you have no choice but to be stuck with it? Is this I don't want to be doom and gloom, but is this the finality of what you've decided?
Yeah.
Because, as science, technology, medicine improves and grows, the options exist and are out there. Hopefully, a physician will deliver that sentiment a little bit more tactfully, but yeah.
Well, I did cut it down to the basics.
Mental note, try not to say those words just like that.
Right. Well, I really appreciate your taking the time to be on this call today. Can you tell the people who are watching or listening where you are and how to find you, and are you doing anything out of, what you're doing is out of the ordinary, but something that they should know about stem cell or platelet-rich plasma that is worth them knowing about?
Yeah. So the details are, the name of the practice is Richard Kim Medicine. Our phone number is 518-871-9900. You can find us on our webpage at richardkimmedicine.com. The practice is wholly and largely dedicated to regenerative medicine. So we want to be that sort of beacon, that light that stands out there as the alternative, the choice apart from the tired old standard. And so we hope to really represent that, but represent that with good, high quality patient care, direct eye contact, all of that good stuff. We do have offices in both Skinny Atlas and Suffern, as well as our main office here in Saratoga. And when you're considering regenerative medicine, think about all the things that make not just a good procedure maker, a proceduralist. Can they just get the needle in the right place? But are they also doing right by you by getting the right diagnosis and looking at the stone from all odd angles and being able to make sure that you get what is needed. And that's where things like evidence and science and everything sort of contribute to and help make that argument. But yeah, if that's what you're considering, please absolutely consider all those things.
Great advice. And I think that if more people did that, they would have better experiences, to really seriously consider not only the physician, but the treatment that the physician is recommending.
Yeah, absolutely. It's a brave new world out there.
That it is, especially these days. Well, again, thank you so much. I really appreciate your being here with me. And for everyone else who's been listening or watching, thank you so much. We appreciate your being here as well, and take good care. Bye for now.